And like all jobs, they're good, it's good days and bad days, but I have to tell you, I've been in healthcare for over 30 years and I can't imagine having done anything else. Once you get into healthcare management, you're going to have a department, you're going to have a budget, you have to deal with workforce issues. Communication is key. But the one thing I tell any young person, education is an investment in yourself, and that's something that no one can take away from you. Hi, my name is Lawrence Mack. I'm the Associate Director of Clinical Integration and Partnerships. I work for the Royal Brompton and Harefield NHS Foundation Trust. I've been here at the Trust just over 7 years. And in my role, I'm responsible for working with clinical teams at the Royal Brompton and Harefield, along with teams at Guy's and St. Thomas Hospital and King's College Hospital and King's College, the university itself, to bring together our teams working in a partnership called KHP Partners to build a new cardiovascular center which will incorporate the clinical expertise among the 3 main hospitals as well as the research and academic skills from the university. On a day-to-day basis, in terms of what I do at my job, I'm working principally on the first phase of this collaboration with our King's Health Partnership. I work with the clinical teams here at the Royal Brompton, so I'm working with our pediatric teams. Our pediatric teams consist of basically heart and lung specialists. So my role is to work with our team here to integrate our pediatric teams with the heart and lung teams at the Evelina Children's Hospital, which is part of Guy's and St. Thomas Foundation Trust. So there are a series of meetings. We have internal meetings talking about our services, our teams, you know, what we do and how will that interface with what they do at the Evelina. So we meet internally, then we meet as a group with the Evelina teams and also members from King's College University Hospital as well, to talk about patient pathways, how we deliver care currently in our existing environment. What does that mean for the future? What does that mean in terms of redesigning patient pathways and patient flows, how teams come together? So there are a lot of meetings. There are meetings every week about the clinical pathways, clinical teams, engagement. There are meetings about buildings, brick and mortar. You know, we have to actually create new facilities. So what does that mean? So there's a whole team of people looking at what would this new pediatric extension look like and how will that interface with the rest of children's services at the Evelina Children's Hospital. So loads of meetings around estate, a lot of meetings around clinical pathways. Then we have this whole issue around how do we build an integrated team working on 2 sites. So that's our next phase. So we are lots of meetings about clinical practice, getting to know each other, because we are a heart and lung specialist hospital. They provide children's services, the complete children's services. So their heart and lung are just a subset of what it is that they do at Evelina, but it's bringing the larger cardiovascular services together in those teams. And those teams include intensivists, and it includes allied health professionals, which are physios and occupational therapists, speech and language therapists, pharmacists. All of those people work together to create this new team. So that's what meetings are constant and ongoing. The key skills required for my role, one is experience. You have to have experience having worked in healthcare. Experience, I think what I bring uniquely to this role is I'm an American, so I've worked in 2 different healthcare systems, and how we do things in America is very different in many ways how the National Health Service works. So it's understanding the differences in care delivery models and making sure that you not only pull from what my experiences are, but we look around and see what's going around the world. So part of it is being able to survey the landscape in healthcare internationally to find out, because what we want to do is be able to bring in research and look at different delivery models of care. So you have to have a mind that understands healthcare delivery systems across the world and internationally. As I said earlier, communication is key, but engagement, you have to be able to engage people at every level, as I said, so those are level skills. And the other thing, you have to educate yourself. My education is very diverse. There is no straight answer to how I got here. I got here in different journeys along the way. A lot of people can figure out, I want to be a nurse, I want to be a doctor, and all of those things are fine, and the straight pathway that you can get to getting there. There's some people who truly want to be administrators, like what I'm doing. But that's not my journey, and that's not how I got here. I've gotten here through trial and error. What I would tell any young person, be open, be flexible. If you know exactly what you want to do, that's great. And if you don't know, you have to try a whole lot of things to get there, which I've done. I've tried, I wanted to be a psychologist, I wanted to be a radiographer, I wanted to be a nurse, I wanted to be a doctor. I wanted to do all these various things, but the one thing I found out where my love lies was helping healthcare people to deliver care, because I just couldn't do the hands-on direct patient care. I tried it, didn't like it, wasn't me. Then I got into health education, science and biology, great. I got my certification as a science teacher, fine. I never did any teaching. I ended up working in public health, which was completely different than teaching. So you have to be flexible and go where the opportunities go where your passion is, and learn from and take in every experience that you have. My degrees are in health education, city planning, business administration, all of these things. So all not related to anything to a single chosen profession, but they've all put me on my trajectory to where I am today. In terms of academic preparation for a career in healthcare management, it is now a prescriptive way to get there. As I said earlier, I didn't get there the traditional route. I came in through trial and error, and I found my place in healthcare management. There are, basically, you can go to university and get degrees in healthcare management. So if you want to get in healthcare management, you can get an undergraduate degree in business administration or healthcare management itself. You go to graduate school, you can get a master's degree in business administration with an emphasis on healthcare management or communications or marketing, whatever you decide you want to do, or finance for your MBA. You do need to understand finance. You don't have to be an accountant, but you have to be able to read financial reports. You have to understand what a financial report tells you. Because once you get into healthcare management, you're going to have a department, you're going to have a budget, you have to deal with workforce issues. So you're going to have to understand HR policies, practices, and procedures. As a part of your education, you will get that in your training and as you educate yourself in your MBA programs. You can do like I did. I have a doctorate in business administration. I didn't get a doctorate because you need a doctorate or a PhD in management to manage people. It was for my own personal goal because I was teaching at a local university. So I did it for an educational purpose, not because of practical purpose that you need as a manager. But the one thing I tell any young person, education is an investment in yourself, and that's something that no one can take away from you. So educate yourself, invest in yourself, and set your own goals about where you want to take your career. So when I did finance is very different than accounting. I think a lot of people confuse the two. I was afraid of, my God, I don't want to be an accountant, I can't do this. But when I went through my finance class, which is a totally different way, you do understand some accounting principles, but it's not being an accountant. So don't be afraid of entering the area of finance because you're going to need that. Economics is another area. You have to understand health economics. What does all of that mean? Supply, demand, because those things are very important. The healthcare economy and the shrinkages that we're having. There's a lot more demand for healthcare services than we actually have money. So what is the future going to hold for new people coming into healthcare? It's very challenging, it's very tough, but it's very rewarding because at the end of the day, everything we do and everything we say has a focus on patients and patient outcomes. So no matter how tough it gets for you, if you want to enter this field, It's very rewarding. At the end of the day, I go home knowing that I made a difference in the lives of some sick child or some sick patient, and that makes me feel good because I, as a manager, was able to make sure that the clinical team had the resources that they needed to do their job. So your job as a manager is balancing the financial budget that you have against the needs of a clinical team so that they can deliver good outcomes to patients. Well, in terms of whether you should seek an apprenticeship or a university, I'm going to tell you, you need to do both. And the reason you do both is totally different. If you're going to go into healthcare management, you must get a degree. But you can also do, following your degree, you can get an internship because you can become into these management programs. Because when you finish university, you don't know anything about management, you've not managed people, you haven't managed a department or anything like that. So there are programs once you finish your training to get into those programs. They're similar to apprenticeships, but they're really not. They're internships for people who've gone to school, gotten a degree, but have no experience. So you want to get on a management training program, but in order to do that, you have to educate yourself. Where would you like to work? Who should I work for? Should I work for government? Should I work for private entities? Should I work for a non-for-profit organization? A lot of this has to do with your own motivation. I know people say working in the private sector is terrible, it's bad, it's money and it's greed. Everything we do is a business. The NHS is a business. The not-for-profit organizations are businesses as well. They just don't have shareholders, so they don't have to return whatever money they make, they put back in the organization, just like the NHS. Whatever money we make, we put back and invest it in the organization. For-profit organizations or attorney shareholders that put in investments, so they expect a return on their investment. So organization you can work for, you work for National Health Service, you can work for the Department of Health, you can work for the private sector as well, you can work in non-profit organizations, you can work for global organizations as well. So I tell people you have to be comfortable about where your values. If you want to work in a for-profit, that's perfectly fine. And if you don't, like I do, I don't believe in that making money off of people being sick and not being able to take care of themselves. So that's just a personal thing for me. So I tell you, pick your own area and have a good time at it. As a young person starting out for your career and you're unsure about what you want to do, as I said earlier, one of the things I would say is be very flexible, be very open to exploring different things. When I started out, as I said, I started out working in healthcare when I was 16, and I worked as what we called in America was called an orderly, and it's the equivalent of a healthcare assistant in the UK terminology. So I did that to try to fill out, well, do I really want to do hands-on care? It was fine doing that. I worked as a physiotherapy aide because I wanted to be a physical therapist, and it says, well, let me try that for 3 or 4 months. So I was lucky and I got a job for 3 months and I did that, and I realized, that's not for me either. So just the flexibility is the key. Try different things. I didn't start, as I said, I didn't start off in management because I wanted to be a hands-on provider, but then I realized I tried these various things that weren't good for me. So do explore various opportunities. Go and look and see what you like and don't like. Try out many things. One of the things I actually did, I was a secretary once, just because I wanted to type and improve my skills using a typewriter. I know a typewriter is probably not what we use now, word processor and all these other kind of things. Now we use computers for everything. But it's all about being open and being flexible. And that's the strongest message I can give any young person is keep an open mind about experiences and try to experience as much in the healthcare space as you can. And then once you're comfortable and you decide that, I've tried a little bit, I tried this, I tried that, and I tried these various things, but this is something I really, really want to pursue, whether it's healthcare management or something in that realm, then you go for it. In terms of what I look for people just coming out of school for just basically to get your first job, you don't have any experience. I already know that. So we do look at your grades. We look at how well you've done in school. So we'll ask you, let us see your grades, the subjects that you did well in. That's just an indicator of what your interests are. But it's also about how well you interview. Because for me, I want to see how you express yourself. I want to know what you're passionate about. I want to know you as an individual. Not just, well, here's how well I did in school. And you could be very, very smart, but doesn't mean you can do my job. I want to know that you have, it's more than just what you've learned in school, it's how you apply what you've learned. What common sense you have, what's been your experiences, the kind of things that you've been exposed to. What do you read? Are you on your iPad all day and all night, or your iPhone all day and all night? And if you are, there's nothing wrong with that. But what are you doing with it? Are you doing things to improve your level of knowledge and skills? Or are you just doing things socially to talk to your friends? So it depends on all of those things when I'm talking to young people. I want to know you as a person, but I want to know that you actually are aware of what's happening in the world. That if you're going to come into healthcare, you've read something about healthcare, you understand the health economy, what's really happening out there and how tough it is. Because at least you've read the newspaper, maybe you read a healthcare journal, maybe you read an article on healthcare. Any of those types of things that you can do shows the employer, person that's interviewing you, that you have an interest and you're not just taking this very lightly, that you really do want to pursue a job in healthcare, even if you're not quite sure where you want to be at the end of the day, but at least you've shown some interest by doing some preparation about the field that you would like to enter. Now, in terms of getting into healthcare management, people always want to know, how much money can I make? Is all of this worth it? Is aggravation? Is it really worth it? The answer to that is yes. You can make. Are you going to be rich overnight working in healthcare management? Probably not, because you don't go into healthcare management because you want to be rich. You know, are there people that are wealthy out there? Yes, in the private sector, big corporations, yes, and most people are never going to do that. So my rule of thumb, you should always aim for a salary 1.5 times your age. And I know a lot of people don't subscribe to that, but you take your age and you just put that is my minimum plus 1.5. That is where you're trying to go when you take your career, because that's your base of what you want to do, and that's the value that you place on yourself, your education, and your experience. So healthcare, entry-level jobs, depending on which country you're in, but since we're here in the UK, we talk about the NHS, you can certainly expect to make, probably as an entry-level manager, somewhere between 40 and 50 to start with, and then it's upwards from there. If you were in the US, where I came from as a frontline manager, it depends. There are 50 states in America, as you very well know. Each state is very different. I spent the vast majority of my healthcare career in California. Wages are much higher, so it's really hard to say in America, because I think if you came in as an entry-level person into management, you probably are looking at, I don't know, somewhere between 30 and 50 US dollars, which is a little bit less, or about the same range of what you would come in the UK. And in America, your salaries can just go outrageous. If you want to become a chief executive in America, your salaries can go extremely high, 500,000 K up to 700,000 K in the US. Here in the UK, if you want to become an NHS, if you're working in the NHS, some of the extreme salaries at the very top are 250 to 300,000 K. But that means a lot of experience, big organizations. You've had to have worked as a chief exec at somewhere else. So those are the ultimate extreme side. But the people like myself, you do fairly well. So you do a good salary and you have a nice career at the end of the day. Now, as a young person, you're always trying to figure out how can I get work experience? What do I need to do in order to get a job in your organization or an organization like yours? A number of organizations, particularly here in the UK, have apprenticeship programs, and so that's one way to come in as an apprentice. You don't have to have a lot of experience. The whole point of an apprenticeship program is to take you where you are, expose you to the things that you will be exposed to, and let you learn from seeing other people, because you do actually get a real assignment. You get to engage with people at different levels of an organization. Some of the apprenticeships are paid, some are not paid. I think volunteer work is a good way to get into an organization. I know people hate the word volunteer because it means I'm young and I'm not going to get payment. But what you get, you gain the experience. So it's not always about money, it's about what you gain as experience. Because when you're applying to university, they look at what you've done for experience. If you're going to go into any chosen field, they want to know if you have any passion for it. Have you had any exposure to it? So doing volunteer work is actually a good thing. We have an apprenticeship program here at our hospital, and a lot of places have apprenticeship programs. So I would say look for a program. And if you have members or families or friends that work in healthcare, talk to them, because they can actually get you into an organization. I think there's this whole thing of where a lot of parents get to bring your child or daughter or son to work one day. So whatever your chosen profession is, you can come in and see what it's like. And we do that very often. I always tell young people to go into organizations, ask questions. You can make appointments to see people like me. If you know anything, you don't have to even know them. You can say, well, I read about your organization. Would you allow me to come in and talk to you? Could you spend some time telling me about your organization, telling me about what it is that you do? Maybe this is right for you. You may find out, you know something, oh gosh, I really don't want to do that. Or I'm very excited about doing that. It's about making contacts. And it's really hard when you're 15, 16, 17, and you're going into this whole adult world about your future and how do you make contacts. Well, a lot of your contact is through families and friends. You know, people that your parents know, because all parents know someone who knows someone that works in healthcare in some level. Even because they don't have to be in management, they could be a nurse, they could be a ward clerk, but they will know how to get you in touch with some manager if you want to pursue a career in healthcare management. What do I like most about my role? And like all jobs, they're good, it's good days and bad days, but I have to tell you, I've been in healthcare for over 30 years and I can't imagine having done anything else. Healthcare management is one of these things. I don't have children, but I got my need for being parental out doing healthcare management, because the one thing people don't tell you, when you're working in healthcare management, you have to deal with every person as an individual, and you have to understand what motivates them. Very much like if you're a parent, your children respond to different stimulus in the environment or different commands. It's the same thing at work. Yes, there are rules, yes, there are policies that people need to abide by, but there's still individuals that come at work with their own experiences and their own set of values, and you have to find a way to make all of that fit within your healthcare environment and what you're trying to get accomplished. So I enjoy what I do. I wouldn't have done it for as long as I have if I didn't enjoy it. I feel very much appreciated by the teams that I work with and support. When I see a smile on a child's face, or a smile on a parent's face, or even an adult, an elderly adult, where something that I did made a difference, then I feel good about what it is that I've done and the career that I've chosen.